Patient priorities care is an approach to care that involves clinicians considering what matters most to patients when making treatment decisions.
It asks us to allow the patient to dictate what they need first, and allows the patient to express their lifestyle in the context of the healthcare rather than the healthcare expressing how they ought to be working their lifestyle.
I currently have MS, fibromyalgia, glaucoma, scoliosis, just to think of a few. It's very important so that I can live my life the way I want to live my life.
The process starts with identifying the values, and then we talk about the life outcome goals, what the patient is hoping to achieve from their health care. And they are SMART goals, so we do try to make them very specific, measurable, attainable, relative, and time sensitive.
The first time I met with Kizzy was very enlightening. It gave me the opportunity to speak for myself. Kizzy asked me what I would like, and no one has ever done that. The one thing I would ask for is to be able to go places. I would like to be able to go to the mall or going with my granddaughter and buying makeup. Yeah, I can't do those things.
When we get the patient's goals and priorities, we try and change how many specialists they might see, how many medications they're on. So it's kind of a sequential experiment really into what we can change that will not interfere with their life as much as it has been. You know, my to-dos here are to work on your neurologist, you know, and I'll contact Dr. Manning and find out what he thinks about some of your medication. It frees us in some ways from being up against these kind of rigid guidelines we're given through medical research. And it allows us to realize that what's good for some people isn't good for everybody.
When clinicians adopt this approach to care, they actually will see patients adhere more to current treatment recommendations because they can connect that to something that matters most to them.
I feel that we might actually be getting somewhere
Right.
with meeting my goals.
Number one lesson we learned is that we think we know what patients need and want, but unless we really ask, we're not going to know.